If you're over 50 and experiencing occasional dizziness when you stand up, morning headaches that fade after a few hours, or seeing tiny spots in your vision that come and go, you might be missing critical warning signs that Japanese healthcare practitioners have been teaching their patients to recognize for decades. These subtle symptoms, which most people dismiss as normal aging, could be your body's urgent plea for attention before something far more serious occurs. As a cardiologist with over 20 years of experience treating patients with hypertension and its complications, I've witnessed firsthand how early recognition of these warning signs can mean the difference between preventing a stroke and dealing with permanent disability. The Japanese approach to blood pressure monitoring isn't about expensive equipment or complicated medical procedures. It's about understanding what your body is telling you every single day, through signals most people never learn to recognize. Before we dive into these 6 critical signs, if you haven't subscribed yet, I strongly recommend hitting that subscribe button and turning on notifications so you never miss another health tip designed specifically for you. If you find this video helpful, please leave your questions and video suggestions in the comments. I read every single one, and it helps me create more content to help people just like you. Let me tell you about Mr. Robert Chen, a 72-year-old retired accountant from Seattle who came to see me 3 years ago. Robert was the picture of an active senior, playing golf twice a week, volunteering at his local library, and proudly managing his own finances and household. But his daughter noticed something he kept dismissing. Every morning when Robert got out of bed, he would pause for a few seconds, holding on to the nightstand. When she asked about it, he laughed it off, saying he was just getting his bearings. What Robert didn't realize was that this brief morning dizziness was his body's first warning sign of dangerously elevated blood pressure that was quietly damaging his cardiovascular system. The first sign the Japanese check daily is positional dizziness, especially in the morning. This isn't the spinning room sensation of vertigo. It's that subtle lightheadedness or feeling of unsteadiness that happens when you move from lying down to sitting up, or from sitting to standing. In Japanese health monitoring, this is called tachikarami, and healthcare providers teach patients to notice this as a potential blood pressure warning. What's happening inside your body during these moments reveals something crucial about your cardiovascular health. When your blood pressure is chronically elevated or fluctuating dramatically, your blood vessels lose their ability to adjust quickly to position changes. Normally, when you stand up, your cardiovascular system makes instant adjustments, constricting blood vessels in your legs and increasing your heart rate slightly to ensure blood continues flowing adequately to your brain. But when vessels are damaged by prolonged high blood pressure, they become stiff and less responsive. The result is that temporary drop in blood flow to your brain, causing that dizzy sensation. For Robert, this was happening every single morning, but because it passed within seconds, he never mentioned it to his doctor during his annual checkups. The danger isn't just the dizziness itself. What this symptom reveals is that your blood pressure is likely swinging between dangerous extremes. You might have high readings during the day and sudden drops when changing positions. This pattern is particularly dangerous because it means your brain is experiencing alternating periods of excessive pressure and inadequate blood flow. Over time, these fluctuations damage the tiny blood vessels in your brain, setting the stage for stroke, vascular dementia, or transient ischemic attacks. If you're still watching and finding this information valuable, comment the number 1 below to show me you're following along. Now, the second warning sign Japanese practitioners emphasize is morning headaches that improve as the day progresses. Mrs. Patricia Williams, a 68-year-old former teacher from Boston, lived with these headaches for almost 2 years before she understood what they meant. Patricia would wake up with a dull, pressure-like sensation at the back of her head and neck. She'd take her morning coffee, start her daily routine, and by mid-morning, the headache would fade away. She assumed it was related to her pillow or sleeping position. Her husband suggested she needed new pillows, so she tried 3 different types. Nothing helped, but since the pain always went away, she never thought it was serious enough to mention to her doctor. What Patricia didn't know is that morning headaches are one of the most specific warning signs of nocturnal hypertension, a condition where blood pressure rises dangerously high during sleep. When you're lying flat for hours, elevated blood pressure increases the pressure of blood flow to your brain. This creates that characteristic dull, throbbing sensation, usually at the back of the head where it meets the neck. As you wake up and begin moving around, gravity helps blood drain from your head, and the pressure eases, taking the headache with it. Here's what makes this pattern particularly alarming. Nighttime blood pressure is supposed to dip naturally during sleep, giving your cardiovascular system a rest period. When this doesn't happen, or worse, when blood pressure actually rises at night, your heart and blood vessels never get a break from the constant strain. This non-dipping pattern dramatically increases your risk of heart attack and stroke. Studies from Japanese research institutions have shown that people with this pattern have nearly triple the risk of cardiovascular events compared to those whose blood pressure follows the normal day-night rhythm. Patricia's morning headaches were her body's desperate attempt to alert her that something was seriously wrong with her blood pressure regulation. By the time she finally mentioned them during a routine checkup, her nighttime blood pressure readings were averaging 170/100, well into the dangerous range. She'd been living with this for so long that she'd normalized the discomfort, attributing it to stress or aging rather than recognizing it as a medical warning sign. But if you think those first two signs are concerning, wait until you hear about the third one, which many people experience but almost never connect to blood pressure issues. The third warning sign is facial flushing, or a persistent feeling of facial warmth, especially in the cheeks and nose. In Japanese medical practice, this is monitored particularly carefully because it often indicates blood pressure spikes that might not be captured during a single doctor's office reading. Let me tell you about Mr. James Martinez, a 65-year-old retired firefighter from San Diego who prided himself on his fitness and health awareness. James continued working out regularly and maintained what he thought was a healthy lifestyle, but he started noticing that his face would become noticeably red and warm during routine activities that had never affected him before. At first, it happened during his morning walks when the temperature rose above 75 degrees. Then he noticed it during conversations that were even mildly stressful, when lifting anything moderately heavy, or even while reading the news if the stories were particularly frustrating. His wife commented that his face would turn quite red during these moments, but James dismissed it as just his natural complexion or being warm-blooded. He never imagined this facial flushing was actually visible evidence of blood pressure surges happening inside his body. What creates this facial flushing is straightforward but significant. When your blood pressure spikes, the small blood vessels in your face, particularly those just beneath the skin in your cheeks and across your nose, dilate to accommodate the increased blood volume and pressure. Your face has a particularly rich network of these tiny vessels, which is why blood pressure changes become visible there before they're noticeable elsewhere. In people with well-controlled blood pressure, these vessels can handle normal variations without visible flushing. But when your baseline pressure is already elevated, even small additional increases cause noticeable redness and warmth. The reason Japanese healthcare providers teach patients to monitor this sign is because it reveals blood pressure reactivity, meaning how dramatically your pressure rises in response to ordinary daily stresses and activities. If your face flushes during activities that shouldn't significantly raise blood pressure, like having a normal conversation or walking on level ground in moderate weather, it suggests your cardiovascular system is overreacting. This hyperreactivity indicates that your blood pressure regulation system is already compromised, even if your resting readings seem acceptable. For James, this facial flushing was occurring because his blood pressure would spike from his usual 135/85 to over 160/100 during these routine activities. These spikes were causing microscopic damage to his blood vessels with every occurrence. When he finally had 24-hour blood pressure monitoring, we discovered he was having these dangerous spikes 15 to 20 times per day, yet his morning readings at home appeared relatively normal. Without recognizing the facial flushing as a warning sign, James would have continued experiencing this vascular damage until something catastrophic occurred. The fourth sign, and this one surprises almost everyone I tell about it, is changes in your vision that come and go, particularly seeing small floaters, brief blurring, or occasional dark spots. Mrs. Linda Thompson, a 73-year-old librarian from Portland, started noticing tiny gray spots drifting across her vision when she was reading. They weren't constant. They would appear for a few minutes, then disappear. Sometimes her vision would seem slightly blurred for brief periods, then clear up again. Linda assumed this was normal age-related vision changes and that she simply needed to update her eyeglass prescription. She scheduled an appointment with her optometrist, who examined her eyes and told her something she never expected. Her retinas showed signs of hypertensive damage, and she needed to see her doctor immediately about her blood pressure. Your eyes are uniquely vulnerable to blood pressure damage, and they also provide unique warning signs. The retina at the back of your eye contains some of the smallest, most delicate blood vessels in your entire body. These tiny vessels are extremely sensitive to pressure changes, and unlike blood vessels buried deep in your organs, an eye doctor can actually see them directly during an examination. When blood pressure is chronically elevated, these delicate retinal vessels begin to show damage through small hemorrhages, areas of oxygen deprivation, or tiny deposits that form when vessels leak. The transient vision changes that Linda experienced, those brief episodes of floaters, spots, or blurring, occur when blood pressure spikes cause temporary disruptions in blood flow to the retina or small hemorrhages in these delicate vessels. The spots she was seeing were actually tiny shadows cast by blood cells or cellular debris floating in the fluid of her eye, released during these microhemorrhages. The brief blurring happened when blood pressure surges caused temporary swelling in the retina or disruptions in the normal fluid balance of the eye. What makes these vision changes particularly significant as warning signs is their timing and pattern. If you notice these changes during or shortly after physical exertion, emotional stress, or when you've consumed more salt than usual, they're likely related to blood pressure spikes. The transient nature means your body is still compensating, but it's struggling to maintain normal function during pressure surges. This is your early warning system, telling you that permanent vision damage could be on the horizon if the underlying blood pressure problem isn't addressed. Linda's case was caught relatively early because she took action on these vision changes. But I've seen patients who ignored similar symptoms for years, eventually developing hypertensive retinopathy, severe enough to cause permanent vision loss. The retinal damage from chronic high blood pressure isn't reversible. Once those delicate vessels are destroyed, the vision loss is permanent. That's why recognizing these early transient warning signs is absolutely critical. If these warning signs are resonating with you or someone you care about, leave a comment below so I know this information is helping real people. The fifth warning sign is one that many people experience but rarely discuss with their doctors because it seems too minor or embarrassing to mention. It's the sensation of your heart pounding or becoming aware of your heartbeat during rest, particularly when you're lying in bed at night or sitting quietly. Mr. David Park, a 69-year-old retired engineer from Chicago, started noticing this about 18 months before he came to see me. He would be reading in his favorite chair or lying in bed trying to fall asleep, and he would become acutely aware of his heartbeat. It wasn't racing, it wasn't irregular, but he could feel it strongly, almost as if his heart was beating harder than necessary for someone at rest. David described it as feeling like his heart was working too hard even when he wasn't doing anything demanding. Sometimes he could even see his shirt moving slightly with each heartbeat when he looked down. At night, when lying on his left side, he could hear and feel his heartbeat so clearly it was difficult to fall asleep. He mentioned this to a friend who said it was probably just anxiety or stress, so David tried relaxation techniques and meditation. While these helped him feel calmer mentally, the forceful heartbeat sensation persisted. What David was experiencing is called a hyperdynamic circulation, and it's a significant indicator of elevated blood pressure. When your blood pressure is chronically high, your heart has to work much harder to pump blood through vessels that are constricted and resistant. This increased workload means each heartbeat is more forceful than it should be. During activity, you might not notice this because your attention is elsewhere, and a stronger heartbeat seems appropriate. But during rest, when your heart should be beating gently and efficiently, this excessive force becomes noticeable and often alarming. The reason this symptom is emphasized in Japanese blood pressure monitoring is because it indicates left ventricular hypertrophy, a condition where the main pumping chamber of your heart has become thickened and enlarged from working against high pressure for too long. This isn't something that happens overnight. It develops gradually over months or years of elevated pressure. By the time you can feel your heartbeat forcefully during rest, your heart has already undergone significant structural changes. These changes increase your risk of heart failure, arrhythmias, and sudden cardiac death. When we performed an echocardiogram on David, we found that his left ventricle wall was significantly thickened, and his heart was indeed working much harder than it should be, even at rest. His blood pressure, which he thought was only slightly elevated at around 140/90, was actually causing serious cardiac remodeling. The pounding sensation he felt was his enlarged heart muscle contracting forcefully against elevated pressure in his blood vessels. This was his body's way of alerting him that his cardiovascular system was under dangerous strain. The sixth and final warning sign is one of the most subtle but potentially most significant. It's changes in your mental sharpness or episodes of confusion that seem to come out of nowhere, particularly difficulty finding words, temporary memory lapses, or moments where you feel mentally foggy. Mrs. Helen Kowalski, a 76-year-old former nurse from Minneapolis, started experiencing brief episodes where she would suddenly struggle to find a common word during conversation. She'd be talking normally, then pause mid-sentence, unable to recall a word she'd used thousands of times before. Within a minute or two, it would come back to her, but these episodes became increasingly frequent. Helen also noticed that sometimes when she was doing routine tasks, like following a familiar recipe or organizing her medications, she would momentarily forget what step came next, even for procedures she'd done countless times. These episodes were brief, lasting only seconds to a few minutes, but they were frightening. Given her nursing background, Helen worried about dementia. But she was only 76 and had always prided herself on her sharp memory. She was terrified to mention it to her doctor, fearing a diagnosis of Alzheimer's disease. What Helen didn't realize is that these transient cognitive symptoms were actually warning signs of blood pressure-related impacts on her brain. When blood pressure is chronically elevated or fluctuating significantly, the blood flow to different regions of your brain becomes inconsistent. The brain is extraordinarily sensitive to changes in blood supply. Even brief reductions in blood flow to specific areas can cause temporary dysfunction in whatever those brain regions control. For Helen, when blood flow to language centers in her left temporal lobe dipped during blood pressure fluctuations, she experienced word-finding difficulty. When flow to her frontal lobes dropped, she had trouble with sequential thinking and planning. These episodes, called transient cognitive impairment, are warnings that your brain is experiencing the effects of unstable blood pressure. What makes them particularly dangerous is that they indicate your brain's autoregulation, its ability to maintain constant blood flow despite pressure changes, is failing. In Japanese medical practice, any report of these transient cognitive symptoms prompts immediate and comprehensive blood pressure evaluation because they often precede more serious events like transient ischemic attacks or strokes. For Helen, 24-hour blood pressure monitoring revealed dramatic pressure swings from as high as 180/110 down to 95/60 throughout the day and night. These wild fluctuations were creating periods where her brain was either flooded with excessive pressure or starved for adequate blood flow. Each fluctuation was causing tiny areas of damage in her brain tissue. Over time, this creates what neurologists call silent strokes or white matter disease, permanent brain damage that accumulates gradually until it causes noticeable dementia symptoms. The brilliant part of Helen's story is that she did speak up, despite her fears. Once we stabilized her blood pressure and eliminated those dramatic swings, her cognitive symptoms completely disappeared. She regained her word-finding ability and mental sharpness. But if she had waited, if she had remained silent out of fear or assumed it was just normal aging, those transient symptoms would have eventually become permanent cognitive decline. So what should you do with all of this information? First, understand that recognizing these warning signs doesn't require any special equipment, just attention to what your body is telling you. The Japanese approach to blood pressure monitoring emphasizes daily self-awareness, because your body provides far more information than any single blood pressure reading at a doctor's office can reveal. Start paying attention to how you feel when you change positions, especially in the morning. Notice if you have headaches that follow a pattern related to time of day. Watch for facial flushing during activities that shouldn't cause it. Be aware of changes in your vision, even if they're brief. Notice if you can feel your heartbeat during rest. And most importantly, don't dismiss changes in your mental sharpness as just getting older. If you recognize even one of these signs in yourself, it's time to have a conversation with your healthcare provider. Don't wait until your next scheduled appointment if it's months away. These signs warrant evaluation now. When you do speak with your doctor, be specific about what you're experiencing, when it happens, and how often. Consider keeping a simple diary for a week or two, noting when you experience any of these symptoms and what you were doing at the time. Your doctor may recommend 24-hour blood pressure monitoring, which provides a much more complete picture of your blood pressure patterns than office readings alone. This monitoring can reveal nocturnal hypertension, blood pressure variability, and the spikes that cause many of these warning signs but might be missed during a brief office visit. You may also need tests to evaluate if there's already been damage to target organs like your heart, eyes, kidneys, or brain. The good news, and I want to emphasize this, is that when caught early, high blood pressure and its effects are largely treatable. Blood pressure medications have improved tremendously, and lifestyle modifications including dietary changes, stress management, regular physical activity, and sleep improvement can make significant differences. The key is recognizing the warning signs while there's still time to prevent irreversible damage. Remember Robert, the retired accountant with morning dizziness? With blood pressure management, his positional symptoms resolved, and follow-up testing showed no stroke damage. Patricia, with her morning headaches, now has normal nighttime blood pressure and wakes up headache-free. James no longer experiences facial flushing during routine activities. Linda's vision changes stopped, and her retinal examination showed no progression of damage. David's pounding heartbeat became normal as his blood pressure stabilized and his heart gradually recovered. And Helen regained her mental sharpness completely. These outcomes were possible because they recognized warning signs and took action before catastrophic events occurred. Your body is constantly communicating with you, sending signals about what's happening inside. These 6 signs the Japanese have taught their aging population to recognize daily could be the difference between preventing serious cardiovascular disease and dealing with life-altering consequences. Don't ignore what your body is telling you. Pay attention to these subtle changes. Document them. Discuss them with your healthcare provider. And remember, while this information is educational and based on my clinical experience, it's not a substitute for personalized medical advice. Every person is unique, and what these symptoms mean for you specifically requires professional evaluation. If you found this information helpful, please share this video with anyone over 50 in your life. These warning signs could literally save someone's life. Drop a comment below letting me know if you've experienced any of these signs, or if you have questions about blood pressure management. I read every comment and use your questions to create future content that addresses what you need to know. Take care of your health, pay attention to your body's signals, and remember that recognizing these warning signs early gives you the power to protect your cardiovascular health for years to come.